perception of pain varies from person to person. One person might have a broken bone and not even realize it, while another might feel significant pain from that same injury. That's because pain is mediated by nerve fibers in your body. And these nerve fibers have the job of sending pain signals to the brain, which happens very quickly. Once they find their way to the brain acts to make you aware of the pain. Because every person's body is different, their nerve fibers and their brain can react differently to the same stimuli. That helps explain why pain perception and pain tolerance can differ so much from one person to another. There are 5 common types of pain, but some pain can fit into more than one category, which is where the complication comes in. The 5 most common types of pain are acute pain, chronic pain, neuropathic pain, nociceptive pain, radicular pain.
Acute pain means the pain is short in duration, relatively speaking, lasting from minutes to about 3 months, sometimes up to 6 months. Acute pain also tends to be related to a soft tissue injury or a temporary illness, so it typically subsides. Acute pain from an injury may evolve into chronic pain if the injury doesn't heal correctly or if the pain signals malfunction. For home treatment, apply an ice pack wrapped in a towel or ice bath to the affected area. You should never apply a frozen item directly to the skin, as it can cause damage to the skin and tissues. Apply cold treatment as soon as possible after an injury. Use cold therapy for short periods of time, several times a day. Chronic pain is longer in duration. It can be constant or intermittent. For example, headaches can be considered chronic pain when they continue over many months or years, even if the pain isn't always present. Chronic pain is often due to a health condition, like arthritis, fibromyalgia, or a spine condition. Natural home remedies for chronic pain. Scientists have been investigating the relationship between omega-3 fatty acids and pain relief since the 1980s. Over the decades, numerous studies have found that omega-3 supplements may help patients lower pain scores and reduce their need for pain-relieving medications. Turmeric's main active component, curcumin, is what gives the spice its yellow color. Curcumin has anti-inflammatory properties, making it a potential treatment for a number of health conditions, including reduced pain and increased ease of movement in people with osteoarthritis. Grapes contain an antioxidant-like compound known as resveratrol, which helps to relieve back pain. It stops certain enzymes from contributing to tissue degeneration, he said. The breaking down of these tissues, particularly in the back, may instigate cartilage damage. Neuropathic pain is due to damage to the nerves or other parts of the nervous system. It is often described as shooting, stabbing, or burning pain, or it feels like pins and needles. It can also affect sensitivity to touch and can make someone have difficulty feeling hot or cold sensations. Neuropathic pain is a common type of chronic pain. It may be intermittent, meaning it comes and goes, and it can be so severe that it makes performing everyday tasks difficult. Because the pain can interfere with normal movement, it can also lead to mobility issues. Natural remedies for neuropathic pain. Egg white hydrolysate promotes neuroprotection for neuropathic disorders induced by chronic exposure to low concentrations of mercury. Sweet potatoes also have natural anti-inflammatory compounds. Animal research has demonstrated that nerve and brain tissue has shown reduced inflammation after eating purple sweet potato extract. And the high fiber content of a sweet potato extract. And the high fiber content of a sweet potato won't spike your blood sugar because it causes starch to burn slowly. Garlic and onions. These pungent vegetables have anti-inflammatory chemicals that can work similarly to pain medications like ibuprofen. Both work great for swollen joints, and garlic in particular can help ease injury-related and chronic back pain. Radicular pain is a very specific type of pain can occur when a spinal nerve gets compressed or inflamed. It radiates from the back and hip into the legs by way of the spine and spinal nerve root. People who have radicular pain may experience tingling, numbness, and muscle weakness. Pain that radiates from the back and into the leg is called radiculopathy. It's commonly known as sciatica because the pain is due to the sciatic nerve being affected. This type of pain is often steady, and people can feel it deep in the leg. Walking, sitting, and some other activities can make sciatica worse. It is one of the most common forms of radicular pain. Capsaicin is taken from chili peppers. It works mainly by reducing substance P, a pain transmitter in your nerves. Results from RCTs assessing its role in treating osteoarthritis suggest that it can be effective in reducing pain and tenderness in affected joints, and it has no major safety problems. Preliminary evidence suggests that devil's claw may help relieve neck and low back pain. In a small study of 63 people with mild to moderate back, neck, or shoulder pain, taking a standardized extract of devil's claw for 4 weeks provided moderate relief from muscle pain. The active ingredient in wintergreen oil, methyl salicylate, is closely related to aspirin and has analgesic and anti-inflammatory properties. As such, products containing wintergreen oil are often used as an anti-inflammatory and topical pain reliever. Thank you for watching.